So our next presenter is Dr. Tonja DiCamillo. She is a solo pediatrician who brings in her own unique experiences to serve her patients. Dr. DiCamillo was born in Western Pennsylvania, but by the age of 3, moved to South Korea with her family. Her parents were missionaries, and she spent most of her childhood in South Korea. She later returned to study pre-med in Quincy, Massachusetts, at a small Christian liberal arts school, Eastern Nazarene College. While she was there, she worked at Mass General Hospital as a pharmacy technician on the pediatric floors. She then did research for a year at Boston Children's Hospital in bone development. Dr. DiCamillo then went to Temple Medical School in Philadelphia and then came to Mercy Hospital here in Pittsburgh for her residency in pediatrics. While in her residency, she took special interest with special needs children and studied complementary treatments that are available. She currently works at the Bradley Center as their medical doctor and as Mount Lebanon School District's pediatrician. Dr. DiCamillo is married to a pastor and has 3 children. Each of her children is in different stages of childhood and offers her personal experiences to augment her practice. Please welcome Dr. DiCamillo.
So you're having a long day, I see. The good news is my presentation is shorter, and I'm going to give you a lot of opportunities if you want to ask questions. I welcome you to raise your hand, and we'll try to make sure we stay on time. I have a handout that we can copy at the end if you want, but I wanted to give you an overview on allergies. And this first one may be a title, but it's going to tell you the background about allergies. As you see, we have 2 knights fighting it off. And basically, allergies are our immune system going wrong, and is our allergies a friend or foe? We have 2 helper cells that are involved in our immune system. They are the T1 and the T2. If our immune system works well, it's our T1 helper cell. When our allergies go wrong, it's our T2 helper cell overreacting in a situation. And then it's release of our IgE cells with the histamine that causes to have a reaction to an allergen or a protein, and that's the beginning of our allergies. And so that is, in a nutshell, what an allergy is. And one of the things we have to be careful about, and you notice I said be aware to beware. Deanna has seen often when I'm doing these physicals that one of the best things we can do to find out the hidden allergies is be understanding that there's a triad between allergies, eczema, atopic dermatitis, and asthma, and to ask the right questions. Often you send those lovely questionnaires home to find out if children have medical problems like asthma, eczema, or allergies, and you ask if they are taking medications, but they don't give you those answers, and then you find out the hard way when they have a severe reaction that they do have one of these problems that are interrelated. And so I've gotten very creative in my questions to ask, do you take a vitamin or a pill, or do you use something that you inhale every day? And I find out, as we're going through those questions, that, oh yeah, I do take a vitamin every day. What do you take it for? And then looking for signs as we're going through on the physical of whether or not they have one of these 3 things. If you have one of these, there's a good chance you have one of the other 2, because they all involve the same reactions of that T2 helper cell and IgE reaction, because they are interacted. Common allergy triggers in children are the outdoors, such as tree pollen, plant pollen, the insect bites or stings. In the indoor, of course, we're aware of pet or animal hair, fur, the dust mites, mold. Then there are things called irritants. They're not true allergies, but they can cause reactions just as severe, like cigarette smoke, the perfume, or car exhaust. And then foods, which are very common, peanuts, eggs, milk, and milk products. There are over 6 million children who suffer from the food allergies, and these are the ones you deal a lot with in the school systems. The most common food allergies are corn, the milk and dairy products, peanuts and tree nuts, sesame, shellfish and other seafood, soy, and wheat. Quick discussion is back when they were doing studies on the allergies and how to prevent the immune system from going wrong, there were a couple studies that they have done. They did what's called the French farmhouse study. Are you guys aware of that? They talked about the farm children. They have found that early exposure to things like animals can prevent your immune system from developing the wrong way. So if you grew up on a farm and you were exposed to irritants or animals from a young age, for some reason your immune system will develop the proper way and go down the T1 direction, not the T2. An example of that is I'm allergic to everything that has fur and feathers except for dogs. Because ever since I was a baby, there was a dog in my house. So I have always had dogs, and I still have a dog. And I'm fine with dogs, but you put me near anything else, I can't breathe, and I break out in hives, and I have an asthma attack. And they actually tested me, and on the scale of 1 to 5, with 5 being the highest, I hit a 5. And I can't even go to like the Washington Fair without pre-medicating myself, because if I get near anything other than a dog, I will react. And it's all because my family has always had a dog in the house since I was an infant. So I proved that study that if you've been around an animal since you were little, my immune system developed properly to a dog, but I didn't develop properly to cats, rabbits, or anything else. And we're going to talk about that with foods too, because one of the early food exposures, I don't know if you know that, but we now as pediatricians suggest that one of the first foods you give to children is peanut butter. So at 4 to 6 months of age, unless you have other risk factors, such as eczema, we tell you to give peanut butter to your child. And so I actually, with my parents, if they're scared, we'll do a food challenge in my office with peanut butter and give a baby peanut butter. So we used to say, wait till you're 1 year old, but we give peanut butter to 4 to 6 month old babies now. Go ahead. Yes. Okay. So that's another reason why we do that, is we have proven that early exposure to foods is part of the reason we want to show that the immune system will develop properly to foods if we introduce them earlier. Okay? So here is a chart that's shown that you can cross-react to certain foods and substances. The most common one, this is a very extensive list, and if you look, it says herbs and spices, that's red. From anise on under mugwort is the cross-reaction list there if you are curious. The one that the allergists always point out is if you have a latex allergy, you can cross-react to melons. I've seen that with some of my patients. My daughter who has a severe latex allergy does not have that cross-reaction yet, but you can develop allergies later. So it's important to watch that. But this is a very interesting because a lot of people who have cross-reactions, you can see that that can happen. So ragweed, you can cross-react to a lot of the things under there. So you need to be careful because of the cross-reaction there. And dust, you can react to some other foods. You see that? So it's very interesting. But I do know people who cross-react from latex to melons in my practice. So they can't eat like cantaloupe because they have a severe latex allergy. So it's important to know that. People who are allergic to strawberry have trouble with mold. That's common. That is actually supposedly the fresh strawberries because of the molds that are found on the strawberries. So a lot of times they can eat strawberries if they are cooked. So that's not really a cross reaction, it's the molds on the strawberries, okay? So this is kind of interesting for people who had food allergies, okay? Whoops. There's 3 ways we test for allergies: the prick or skin testing, and if you see that picture, it's showing you. Prick testing is not with needles. That's what we do for testing for eventual immunotherapy. It used to be, everyone was like, oh, I don't want my kid to get prick testing because they're going to use a needle and stick them. If you look at it, it looks like, I always say it looks like a bottle dryer for all the parents out there. It's a little plastic device that has tiny little plastic ends on it, and they put a little bit of oil on each of those and then flip it over on your arm or your back, depending on how many they have. And the oils have each of the little antigens or proteins of each of the things that they're testing. And then they also put on a control of saline and a control of straight histamine. So obviously, if it's the histamine is going to cause a hive, and the saline should not cause a hive, and they're going to look for hives reacting on your skin for each of the things they're testing. So it doesn't even hurt because you don't even feel it, but what it's doing is make a tiny scratch on the surface of your skin to introduce the oil into your skin. It's just very irritating if you get a positive reaction because it's going to be very itchy right there. But if you're very severely allergic, you could have a full-blown asthma attack and anaphylactic reaction. So that's why skin testing should be done in an office and the person watch. I saw someone go into anaphylactic shock in an office, and we were quickly giving her epi, Decadron, oxygen, and calling an ambulance because she was having a severe reaction to good old environmental allergies. Just because of a skin test, okay? RAST literally means the protein testing or blood testing, and you can do that for everything, and then oral challenge or exposure. Obviously, you don't want to be doing that unless you already know what you're allergic to, but that happens accidentally sometimes, the hard way. That's how I found out I was allergic to pistachios. You can't, the problem about some of these tests, like the prick or skin test or RAST or blood test, they can say you're negative and you still be positive. You have to believe real life. So if you're still negative on the test, but you still in real life had a reaction, go by your real life reaction. I'm allergic on testing to pistachios, but I did an oral challenge, and we know it's the pistachio, and I have to stay away from them. I go into anaphylaxis from pistachios, okay? So you have to, as my allergist said, don't eat a pistachio if you know you're going to react to them, and stay away from them. So the tests are not 100% accurate. Your body may not show the response. For prick or skin testing, they must be off antihistamines and steroids. RAS blood testing, you don't. So if you have someone who has severe asthma allergies and can't come off the medications, the blood testing may be the best choice. Okay? Food intolerances. There's a difference between food allergies and food intolerance. Food intolerance is not a true allergy. It's not a histamine reaction. It's usually not, it's not life-threatening. It will not progress and does not need an EpiPen or antihistamine. But it can cause headache, abdominal discomfort, nausea, diarrhea, skin changes, etc. Example of that is lactose intolerance. But you still should abide by the restrictions and guidances that they give, because it can make them very miserable and cause a lot of medical issues. Signs of allergic reaction, A mild reaction may just be the skin changes like eczema or hives and not go any further. Obviously, you can have sneezing, vomiting, diarrhea, abdominal pain, swelling of lips, mouth, or throat, coughing, wheezing, shortness of breath, coma, or even death. You all are familiar as nurses of your allergy plan that you get, allergic reaction asthma plan that us doctors have to sign and tell you what to give as you're going down. All those symptoms are on that, okay? This is some examples of skin reactions. That one got blurry. One is simple eczema. That's a severe reaction. That's called bulbous contact dermatitis, where you start getting blistering. You can actually even get to the point that you slough off the skin from allergic reaction, and then hives. Treatment of allergies, obviously first thing is like an antihistamine. You may need albuterol, and you can use EpiPen or AviQ. I have for fun afterwards if you want EpiPens. And in case you never got to try the trainer for the AviQ, I got a bunch of those. This one will show you how it works. And if you're not familiar with the AviQ, it talks you through how to use it. Unfortunately, not all the insurance cover this, but this is very nice for younger kids or kids who go between different homes, because it tells the parent or the child exactly how to use it, unlike the EpiPen. And I also bought a inhaler, an air chamber. This is the one with the mask. One without the mask would just have the mouthpiece. And then I also, in case you never seen what one of the discus looks like, this is a discus for like Advair. Alternate methods that are out there, do they work? Like the bee pollen and local honey? No evidence. They don't decrease your reaction, and actually can cause anaphylactic reaction or systemic reaction, because they can't guarantee how much you're being exposed to. So it's a dangerous way to treat your allergies, okay? So I work with my parents with homeopathic methods. I tell them that this is kind of dangerous if they're trying to treat them little by little with this, because they can't guarantee how much is in each of it. That the sublingual or oral immunotherapy does work. This is a study that was done, and this discussion that they're talking about, whether or not how young is too young that our students can give the medications. There's a discussion between the pediatric allergists and caregivers of how young they can give them. Allergists say children 9 to 12 can describe that they are in trouble and their symptoms and can carry the medications, but they're not really comfortable with them unless they're 12 years old. Caregivers say that children as young as 6 are mature enough and able to give the medicines and carry them. So we may need to look at the individuals and make the decision between somewhere in between there. And you may know students yourself that you feel are very comfortable that are somewhere between 6 and 12 who are very capable of giving them and can do it. I'll tell you, I have patients in my practice who are somewhere between 6 and 12. I wouldn't say as young as 6, but probably about 9, who I feel very comfortable that can show me that they can use these, either one of these, and know exactly when they are having trouble. But I also have 18-year-olds who I can tell you they don't know when they're having an asthma attack and don't know when they even how to know when to give it. So it really depends on the individual patient. And I'll tell you, I have allergists who tell me the same thing, that they have teenagers who don't know what they're doing. So it really does depend on each patient, okay? Oral immunotherapy. There was this huge study that's been going on with the sublingual and the oral therapy in the last 3 years. And this results have come out, and because of that, they have started doing this. And there's Children's Hospital's doing it, AGH is doing it, and there's a doctor in McMurray. He has started the oral and sublingual therapy with the peanut butter. But this must be done with an allergist who knows what they're doing. And it has to start in the allergist's office, okay? And then the maintenance is done at home. But the actual beginning of it has to start in the allergist's office. No parent should do this on their own, because obviously it's dangerous, okay? Because you could kill the kid if it's not done properly. But it causes a buildup of the tolerance to foods that trigger life-threatening allergies. This also is done with environmental allergies too, which is interesting. That you can, and they put drops, and it's interesting that they can do it with the environmental too, not just food allergies. Peanut butter though is the big one, because that's the study they did it on. Goal to experience mild symptoms, so that if they accidentally get some peanut butter somewhere, they're not going to die from it, okay? But they have to continue to take peanut butter for the rest of their lives every day. My understanding is about 9 peanuts. They have to eat 9 peanuts a day, approximately, whatever is equal to that, also in peanut butter, for the rest of their life to maintain that maintenance, okay? And so you start with the allergist. They swallow liquid containing trace levels, or they give them a peanut butter. And you closely monitor this process to lower your risk. And then you must take that same amount daily for the rest of your life. But is it worth it? It's just like you do with the bees and everything else. You no longer have to worry about a severe reaction. So no longer knowing that your child may accidentally ingest a brownie at someone's house and worried that they may die. I think it's an amazing step forward from what we had in the past. Insect allergies. Every time I see that picture, I don't like that picture. There's 5 main categories. Bees, the wasp, hornet, yellow jacket is another category. You can be allergic to the bees and not to the other one. Mosquitoes, ants, and fire ants. You have local reactions, systemic reactions. There is a difference. It's reaction to the saliva and venom, and you can go through the immunotherapy, and 90% no longer will have systemic reaction. Hay fever, obviously it's environmental. Again, you can react to the particles in the air. You start out with the simple symptoms, but it can lead to systemic reactions that also shortness of breath and asthma. If one of your triggers for asthma is hay fever, it's very important to treat that so you don't have progression with the asthma. More than 9% of children live with asthma. It is the #1 chronic cause of being absent from school. Boys are more affected than girls. African Americans are 3 times more likely to have serious problems with asthma and are underdiagnosed. Pittsburgh ranks 27 among 100 U.S. cities where it is challenging to live with asthma based on how prevalent asthma is, risk factors, and medical factors. Asthma is caused by the inflammation or swelling and the airways, and obviously we all know the symptoms. And obviously one of the triggers are the allergies, and if we can treat those, if you can treat one of the triggers, you decrease the severity. So we can treat the allergies, it makes a big difference. How many of you have asthma? Now see how many? That's quite a bit. So you know how it feels, right? I was gonna say, I thought about making you guys play 40 breaths. Anybody know what that is as a kid? You hold on to each other's chests and you make them keep taking breaths until they can't take deep breaths. You can pass out at the end. It was to give an idea how bad it feels. And those who have asthma know how it feels. Because basically that what happens with asthma. My husband used to play that with his siblings. Bad game to play, but it gives you an idea of how it feels with asthma when you have an asthma attack. I rarely have them. I have them with my reaction to my allergies. So I know how it feels because I can't breathe. That's exactly how it feels, right? you get less and less air until you pass out. That would be a good example if you really want to know how it feels, but I don't recommend playing that game all the time. But if you wanted to just try it to see how scary it feels, that's how it feels, okay? All right. So I wanted to end on that because that's how we often see the presentation, is more like not being able to breathe, okay? And we see it more as asthma for the presentation. Now, questions? And then I'll put these up here for toys. If you want to try, this is the AviQ and stuff. But do you have any questions? Yes, very high. Allergies, asthma, and eczema. The weird one is medical allergies, like drugs, unusual to have a link. So like penicillin, amoxicillin, that type. Any other? No more? Did we catch everything? I think that's all. There's no other homeopathic treatments going on right now. I did look for all of them because my patients always come in asking me, because as I said, I have a large group who are interested in it, and they know that I will work with them on treatments and look them up. I always ask them, just ask me first before you try something. I don't just dismiss them. That's part of their attraction to come see me, because with me going up overseas, I tell them I'm willing to look, and I won't dismiss them, and I will do the research for them. There's actually a lovely NIH site that has all about homeopathic medications. Now, one of the things I do warn them, if you do have allergies, a lot of your homeopathics you may have cross reactions too. So like obviously if you're allergic to ragweed, you don't want to take chamomile tea. So, because they are the same family. Not a good thing to do. Okay. Anybody, if you want to come up and try these, you can, because these are pretty cool to see how these work. And if you haven't ever tried the EpiPen trainer, you can. I will tell you, have you ever seen how far these go into something, the real ones? In a 4x4, they go this deep. I took one of my expired EpiPens and shot it into a 4x4 and couldn't get it out. That's how strong they go in. They can break bone, so it is very important to make sure you do put it into the thigh away from the bone. They're made to go in and not come out until they inject all the medicine, because it's important not to miss. So don't be scared to use it, but they're made to be a forceful release to make sure you don't miss, okay? But yeah, it was quite interesting to see how well they work. Luckily, I've never had to use one on myself yet, but I saw how strong they work, and I've seen how strong they work. But you know what? When you can't breathe, you don't care. But they do work really well, okay? If some reason, AviQ has a program to help pay for these. So if they have Medicaid, or they're having trouble affording these and the generics, you may want to have them contact AviQ, okay? So this is an option, thanks to, we'll make a comment at the expense of these, okay? Because there's no, other than the generic for EpiPen, there's no other availability of anything right now. There used to be another generic available. There's no competition anymore. Okay? All right. Thank you.